Okay, welcome again to COVID Fighter. This is a new volunteer orientation. Thank you all very much for being a part of this, joining us. It's a privilege to have you here. It's been a wonderful experience to meet people who have an interest in trying to help stop or help mitigate this global virus that we're having. Um, our COVID fighter was started back in April with a little idea of trying to do contact tracing. The hospital that we are associated with, Larkin Community Hospital, was doing some testing and they realized they didn't have people that were doing the contact tracing. They also started doing things like collecting and donating plasma, offering peer support, as well as doing various research projects. And this is one that I landed with as a volunteer I thought I was just going to be doing contact tracing. And lo and behold, I found out that I was involved in helping the different components to make this happen. So I've been here since mid-April, and we currently have we've had over 1,200 people that have shown interest, signed up as volunteers. We have about 130 certified contact tracers, approved contact tracers, and we have probably another 100 that are somewhere in the process of becoming approved. So welcome to the Larkin family. You can see that these are three of the things that we do offer: the contact tracing, the peer support, and plasma donation. Our founder is Dr. Jack Michel. One of the things that he sees is that that this is a challenge. It's a global challenge, and really the people who get involved in things like this, this is really what defines who we are as people. We either jump in and help out, or we run, or we may deny that it's there. But those of us who are here, we want to be part of the solution. I want to look at this from like a global perspective, and then we'll hone it down to a more specific as to who we are and what we do. So very briefly, the coronavirus is a global pandemic. It's a highly infectious disease. It's highly contagious, that is easily spread from person to person, and maybe even through it's potentially airborne. It causes a range of symptoms. Most people, fortunately, have a mild reaction to it, but as we know, it can be deadly as well. And unfortunately, at this point, there is no cure and no vaccine. The global response to COVID-19 has been self-quarantine for those who have been exposed to the virus. And so the way to treat them is that they be quarantined, that they have minimal contact with others, they stay home as much as possible, always be wearing a mask, and be watching out for symptoms. Self-isolation, and for those people who are COVID positive, means that they need to be isolated, separated from other people in their own room, hopefully with their own use of bathroom. When they have food, it's in disposable containers so that people don't have to come in contact with it. And social distancing. So staying at least 6 feet from others, wearing a mask, washing hands often. So this has been a global response. The other global response is contact tracing. Contact tracing is the next best thing to a vaccine. Because we find out where the hot spots are. People either quarantine or isolate so that it will mitigate the spread. What is contact tracing? It's identifying and assessing and advising people on how they should be taking care of themselves. We call the people who are working with us contact tracing specialists. So as a contact tracing specialist, you're an investigator, you're a detective, sometimes you'll be a social worker or a therapist. So we play many hats, many roles as a contact tracing specialist, depending on who we're talking with. You'll be talking with people who are infected, and those we call those people person or people under investigation, PUIs. There's a close contact. Those are the people who, anybody who's come in close contact with somebody who is COVID positive, we call them close contacts. So these are the main players in the contact tracing process. Did I hear a question? Yep. So looking more directly at who we are as an organization, the Larkin Community Hospital, we actually have 5 different initiatives, 5 different teams who are working to help mitigate the spread of COVID-19. We have the COVID Fighter Contact Tracing Program, which is you're a part of. We have peer support, so people who are having some struggles or want some additional support. We have some people who can be in contact with them. We have a research team. Many of the people here are international medical graduates, and they're participating in different aspects of research. We have a job search a website that will help to match the job seekers and employers, and then plasma donation. So these are 5 initiatives from the hospital. We are principally with the COVID fighters, but we also intersect with the peer support and the plasma donation. Our team, we have a support team. Dr. Michelle is our visionary leader. Virginia Johnson and myself are project leaders. So as you get involved with us, you'll see that we are kind of in all different places with most everybody. Camilo Hernandez, you will probably interact with him at some point, as he's our app developer and chief troubleshooter for all things technical. And then we have a training team that prepares our volunteers to become approved CTSs. Our frontline team is made up of the contact tracing specialists. Right now, as I mentioned, we have nearly 130 of you all who are out there making phone calls, talking to people who are COVID positive or were in close contact with somebody who is. Our region heads, these are people that will help organize you, help coordinate with you, help direct you. They'll be a great resource. And hopefully you have joined one of the Telegram chat rooms in your region. If not, we can tell you how to do that. And then supervisors who oversee the region heads. So this is the structure of our organization. As we mentioned, we have region heads. We've divided our team up with, this is what the Department of Health and Human Services uses. There's 10 regions. So since we have people from all over the country, and we hope to someday have PUIs from all over the country, we thought it would best to go ahead and divide ourselves this way, so that if we are working with other health services, we can be speaking the same language. So if you haven't signed up for a region, this tells you which region you would be in to sign up with. Now, becoming a little bit more specific, as the COVID fighter, basically we have 3 principal goals with the COVID fighter app. One is assisting in the recovery by helping people track their systems. This is one of the distinctives of our program, because it allows the person who is COVID positive to track their symptoms twice a day. This is something that the CDC recommends for all people who are COVID positive, that they would be checking in with their symptoms. This helps them know when they're getting better or worse. Our app actually sends alerts to people to help them to remember to report their symptoms. And we're just asking for 4 symptoms, but they're crucial symptoms, and they're the most common symptoms. Most principally is that we're watching out for is shortness of breath. That's one that we don't want to see. The second is mitigating the spread of the disease through contact tracing. So we actually built into the app, and you'll learn this as you go through, you'll collect the names and phone numbers of people that the COVID positive person has been in close contact with. And that means that they have been within 6 feet of somebody for more than 10 minutes in an enclosed area. And that they would have been in contact with them from 2 days prior to having symptoms. Those are the people that we will be tracing. The other distinctive about our program is that when you're in the app, we also have the COVID positive person, the PUI, they're in the app at the same time. And you can see what each other is doing. So they can input this information or you can input the information. Even when you finish your conversation with them, if they think of somebody else, they can put that name in. So that's a that's the contact tracing aspect of our app. And third, we want to enable people to, who are recovered to help others by donating plasma. So when they have gone through 14 days after they had symptoms and they're symptom free, they may be eligible to donate their plasma that will help other people. So in our program, we get in touch with those people after 14 days to see if they would like to donate their plasma. So these are the 3 goals that are important to remember as you're using our program, going through our program, and you'll see that throughout the guide, the user guide. When you use the app, this is what it looks like for a COVID positive person. This is actually screenshots from a telephone, so it can be used on a smartphone or the computers. It is web-based, where we don't have a typical app yet with Apple or with Google, but we are in conversation with them. But this is what it would look like if you're on the phone. After you sign up, when they go through and sign up, they will get this. This is what the screen looks like. They will click on self-diagnose. They will answer which symptoms they have, and it will turn to green. And then 12 hours later, it will turn back to red and send them a little ding. And they will do the same thing, press self-diagnose and answer those 4 questions. So it does that twice a day for until they're symptom free. Then as a contact tracing specialist, this is what your dashboard will look like once you sign in. It won't look exactly like this because this is populated with people. These are fake people, so I'm not giving away I'm not violating HIPAA laws here. But this is what it looks like. So real quickly, you'll see here there are different colors. They mean different things. One of them tells you about whether they have attached their COVID-19 report that proves that they're positive. One is about time alerts. So if there's any time that they haven't been tracking their symptoms, they get a time alert and you get a time alert. And then you can also look at their reports. So you can view all of your PUIs that you're tracking through this. One thing that's really important here is CTS status. This is red right now. That means that I have enough people to look for. I don't want any new ones. When you are actually in your dashboard, if you click this, it opens up and you can say CTS ready or not ready. If you click ready, this turns green. And then once you get assigned one, it will turn back to red. So it allows you to populate and work on that person. So that's a quick overview of the dashboard. This is, once you're in there, this is the questionnaire. So you'll be asking them about when their symptoms began, what were their symptoms, how many people are in their household, if they've been contacted by the health department. Also, as we mentioned, you'll be asking them about who they came in close contact with and the places that they were in close contact with others. And when you click on add for one of these, you get a drop-down box. You get this drop-down box. So we ask you to put in the name of the person, their first name, last name, And you just need to get their phone number, really don't need the email. We want to be as efficient as possible when we're talking with the PUIs, be respectful of their time and if they're not feeling well. So just getting a phone number is good enough. And then any notes you want to put down here. Say they had lunch with somebody, you can write who they had lunch with. Or if they'd been to the barber shop or the beauty parlor, you can note that down here. And you always have to remember to click save so that it keeps it. This looks the same for contacts. And then after you finish that, then you talk with them about donating plasma. If they're asked if they want peer support, ask if they want to become a contact tracer. And that's what the app looks like in a real nutshell. The COVID fighter training that you'll be going through, which you've started, it's really self-directed. You go at your own pace. You can go as quickly or take your time as you wish. Principally, this is done by accessing our training team and the materials that are found on our website. So our training team is providing this orientation. We have another presentation on the COVID fighter app instructions. So this talks about how you use the app and how you use the resources, principally the CTS user guide. Then we have a practice interview we ask you to go through with another approved CTS, and then a final interview. Our goal is that you would be confident and competent interviewers when you finish your training. And then this is what's on the website. The website, I think hopefully you've all been to there, is volunteer.larkinhospital.com. You don't have to put the www in front of it, just this. And the important things on there is one is the CTS user guide, which is a step-by-step guide that walks you through the entire process. So it reviews who we are, how we operate, and then just exactly how the application works as well. So it's all in that user guide. Your volunteer to CTS, it's a tab on there, volunteer to CTS. It has the information that you need to become an approved CTS. There are interview guides, which are step-by-step instructions on how to conduct interviews, either with the PUI or a close contact. We have the volunteer to CTS process. There's not a video on there. There will be videos again on there. So these are important things to use while you're becoming a CTS. You can review interviews, meetings, and then the sign up there in order to, if you haven't signed up yet, that's on the website as well. So what are the steps to becoming an approved CTS? You sign up as a volunteer, you take one of the courses, then you need to upload your documents, the course certificate, the photo ID, the non-disclosure agreement. So those are three things that we need before you become a CTS. Participate in new volunteer orientation. We want you now to, after we're finished here, familiarize yourself with the CTS user guide and the app, join discussions in the Telegram, review the training materials, participate in our COVID Fighter app training. They happen on Wednesdays. One is at 11 and one's at 7 p.m. Participate in a practice interview and then a final interview. And then you become an approved CTS. So in a nutshell, that's our orientation. Are there questions that I can answer at this point?
Yes, hi, I have a question.
Yes.
I was wondering, can CTS become part of the peer support team?
I'm sure, yes, of course you can, yes.
Would you need like a special training aside this one, or a special degree or certifications?
No, we can put you in touch with the peer support people, and they can tell you what they're looking for.
Oh, okay.
So,
Yeah.
Is this Jessica? Is that right?
Yes, it's Jessica. Yes.
Okay, well, Jessica, we will get you in touch with, I'll find out who you need to be in touch. I think you just do, it's peersupport.larkin, but we'll check it out and I'll get that information to you.
Thank you. Thank you so much. I was also wondering, I'm not part of my region's Telegram chat, and I was wondering how could I join that?
I think that in the process, in the becoming a CTS, in one of those documents, they have all of that listed.
Okay.
What region are you?
Number 4.
Number 4. Okay. And are you in the main Telegram?
Yes, I am.
Okay. Maybe Nasir, can you find her and then and then invite her to 4? You're not a part of 4, are you, Nasir?
No, I'm in region 2, but I can just
okay.
yeah, message.
Great. We'll make sure that happens, Jessica.
Okay,
Thank
Jessica,
you. Thank you so
I will help you with that.
Yeah.
Thank you.
Yep. Other questions?
Hi,
Hi.
it's Kuvinder. I wanted to know more about the research team that you said that there are medical graduates who are working on research with this. Where can I get more information on that? Or is there any way that I can join in on something?
Nasrin, do you know the answer to that, Nasrin?
Yes, you know, Kulvinder, are you in the main Telegram group?
Yes.
Okay, so if you write that you are interested to join the research group, so we'll be able to add you in the research group.
Okay. Okay. Thank you.
You're welcome.
Nothing else at this point?
You guys can also type in the chat box.
Well, if not, it's thank you very much for being with us this evening. Pleasure to have you here. As we said, any questions that you need, you can find in your in the Telegram. You can ask away. You can ask your region head. You can reach out to anybody, either Nasreen or myself, and we'll do what we can to help you keep on your way.
Dr. John,
yes.
we have one more participant, Jackie. Can you introduce yourself and which region are you? Jackie Mora, yeah.
Yes, it's me. Hi, how are you?
Hi, Jackie.
Yeah, I'm living in Miami. I'm trying to join the Region 4.
Okay.
And a foreign doctor, trying to do my steps here, but I'm figuring out that this is a good opportunity for me to be involved in the community. So yeah, that's my plan. And thank you very much for this program. I'm really excited.
And did you say, so you're not part of the Region 4 chat room yet?
I'm in a chat. I really don't know if it's the chat for the Region 4, but I would like to be in that chat.
Okay, I think that's something else that Nasreen can help you with as well.
Okay, perfect. Thank you very much.
And Sanjana, you want to be in Region 2 chat, right?
Yeah, I think I'm just in the general chat.
Okay, yeah.
Okay, Sanjana, I can help you with that. Okay.
Super, thank you so much for joining us. And have a wonderful evening.
Yeah, thank you, and have a good evening.
Thank you.
Be safe, please.
Thank you. Thank you very much, Dr. John.
Thank you very much. I need to figure out how do I stop. Oh, here we go.